these cases were over what period of time? Starting January 28th? They had been confirmed with the CDC.
So they started in, like, probably about the, like, mid-January, people had started coming in.
No, but
early January.
Yeah, they have been confirmed at the CDC.
Oh.
Because I thought some came in and they weren't even tested at the CDC. Is that true? Or all cases that they thought were COVID-19 were tested?
They're not testing everybody who comes in and thinks they have it. Even people from China.
So you're saying that people were coming in mid-January, but cases were starting, but they weren't fully testing in mid-January. But my question specifically is, when did they start testing COVID-19 at the CDC? What those cases?
They started. The hospitals here started sending samples out in about the early January. A little bit after the first week of January is when they first started sending them out. Around like January 8th or 9th is when they first started sending tests out.
And they still sending them out now? They still have new cases? I mean, there's new cases coming in like yesterday or the day before or today?
I'm not aware of any in the last few days, but there's been several this month and last month.
So you're talking about, when you say several, you're talking 10 to 15 cases then?
I'm talking of at least 6 cases where people have it.
But there's still, my point is that how many do you think have been being tested for COVID-19 since these 6 cases?
My wife only knows of 6, but there's rumors going around the hospital and they don't inform the nurses or staff.
Okay, so we know for sure 6, but we don't know if there's additional cases being tested and not confirmed yet.
If I had to guess, I would say several dozen.
Okay.
Maybe 100.
All right, but we're just going to stick with the 6 right now because that's confirmed. All right, and we know from the database that hasn't been issued by Johns Hopkins yet. So something's not making sense here. You guys had, the hospital still has let out these individuals into the public. There doesn't seem to be a protocol to bring them back. And there definitely aren't. And since you and I both live in New York State, we haven't been informed that this is happening.
Yeah, it's not on like any New York State site. When I go online and I see how many tests there are in New York, Buffalo has tested more people than the CDC in New York State even admits has been tested in New York City. It doesn't make sense that the suburbs around Buffalo are having more confirmed and suspected cases than all of New York City. Amherst is only like 10,000 people, but they're testing more people than all of New York City, which is 9 million. Tonawanda is 10,000 people, and somebody has it.
Okay. Is there anything else that you want to share before I publish this, and then I'm gonna call our senator and figure out what's going on?
I just want the public to be aware, and I want the public to be aware that our hospitals, things like DCMO machines, we only have, like Millard and DeGraaf, they only have a handful each. Millard Fillmore has 5 DCMO machines. They haven't placed orders for masks or anything. I have a friend who owns a private practice here. He only has 20 masks in his office. The hospitals here, they don't have supplies in place or anything. There's not even a poster here. We don't have any. Nobody from the CDC has like came to the hospitals. The management hasn't held a meeting or anything. The hospital staff they're not prepared, and there's no leadership and there's no protocols that have been put into place yet. I want them to, if you have tuberculosis and you're infectious, you can't leave the hospital. They'll get like a court order where you have to stay in isolation. But they're testing people, and people are going back out in the street, walking around before test results even come back. Health Commissioner, she has publicly stated that she's not going to confirm or deny suspected or confirmed cases. So I'm wondering why New York State keeps saying that there's no coronavirus and there's no people being tested for it, but at the same time they've also released statements through the Erie County Health Commissioner saying they won't confirm or deny cases. So they're saying two different things. They need to start putting the numbers on the Johns Hopkins, on the CDC. They need to start putting these numbers up.
I have one last question. Do you know the severity of the 6 cases when they left the hospital?
So 5 of them were extremely mild, and the 1/6 case seemed pretty severe.
And that severe case was let out of the hospital?
Yeah, they were let out of the hospital.
Okay. All right, that's all I had. Is there anything else that you want to share?
I think that's it.
Okay, thank you for your help. And if there's anything that you that would like to share, later down the road, please give me a call. Okay?
Yeah, I really appreciate you getting us out there.
Yeah, no problem.
$64,436, total deaths 1,383, total recovered is 6,886, about 5 times the total deaths as the total recovered. Look at the Worldometer, and we can see here total cases outside of China have kind of remained constant because there hasn't been that redefinition causing a slew of new cases. Let's take a look and see what's going on inside China, or total cases overall. If we look down here at new cases, there's been a dramatic drop in the number of new cases, probably because there was a number of cases that were reclassified. We'll have to watch this and see how things go. Now, remember what we're talking about, these total cases is based on the number of people presenting to hospitals that can get work done on them. Based on some reports that we've been seeing, especially out of the New York Times, there's been a crackdown and a rounding up of people and holding them in quarantine and not getting the medical treatment that they need. Some people, of course, too scared to go and not wanting to get treatment. And so it's unclear exactly how many people are not being counted here, but it's apparent that this is still being undercounted. In terms of total deaths, there has been a jump, and that doesn't seem to be cooling off anytime soon, unfortunately. For the same reason why the total number of cases may be underestimated, the total deaths may be underestimated as well. On the Worldometer latest updates for February 14, we see that there's a report from Hubei province for yesterday that there was 4,823 new cases, including 3,095 that were clinically diagnosed. We can see here that the testing was just kind of underestimating those chronically. 160 new deaths and 8 clinically diagnosed. So we can see that the clinical diagnosis addition to the count is greatly influencing the number of new cases, whereas it's not affecting the number of deaths as much. Total cumulative cases, we can see here that 5,384 were clinically diagnosed. We talked about that. What's interesting here is that 36,000 are currently hospitalized. That's an incredible amount of people that are hospitalized, and you can see here that 73%, so the vast majority of them are in mild condition, whereas 8,000 are in serious condition, and about 4.6% are in critical condition. There's a number of people that are undergoing medical observation because of either their contact or other symptoms that they may have. 2 new cases in Japan, one of them being a surgeon at a hospital who developed a fever and still continued to work as usual and saw patients for 3 days, so that's probably going to have to be followed up on as well. Okay, I want to discuss 3 things.
This is the total numbers for February 16th at 11 p.m. Central Time. Is 70,550 in mainland China. And here are the numbers for the other Asian countries here. U.S., Australia, France, and on down. We go to the U.S. This one in San Antonio here. California, Phoenix, Boston, Toronto, Chicago. See, there's been more reported in New York, but they're just not showing it. See, Buffalo, I don't see it. Here's Buffalo.